Upstate Medical University in Syracuse, New York, invites you to Be the Informed Patient with the podcast that features experts from Central New York's only academic medical center. I'm your host, Amber Smith. Adolescence is a time of major transition for kids physically, emotionally, and socially. This is also when many are exploring their sexuality. Pediatricians can be a good resource during this time, and I'm talking about that today with Dr. Aimee Steiniger. She's an assistant professor of pediatrics at Upstate. Welcome to the Informed Patient, Dr. Steiniger.
Hi, thank you so much for having me.
Before we get into this, can you tell me what are the years of adolescence?
I think it depends on where you're looking, but at the American Academy of Pediatrics, we're usually looking around ages 10 or 11 up until 21.
So, is that the age when kids start seeing a pediatrician confidentially, like 10 or 11, without their parents being in the room?
Yes, I'd say it's likely provider dependent, but I think a lot of us like to start that process early to gain trust with the family and make it an understanding that teenagers and young adults are going to start taking control of their own healthcare and being involved in it.
Do you find that kids are universally more comfortable talking about sex without a parent in the room?
I think that really depends on the family and the young adult. I think there are some youth who really do seem to open up if I'm talking to them alone. And there are plenty that feel comfortable having those discussions with their parents in the room. It's kind of part of my job to figure out where we are in that space and which way I can help the adolescent the best.
Now, when do you recommend that a girl start seeing a gynecologist?
So that I think is pretty pediatrician or provider dependent as well. I think we have moved the guideline for pap smears to age 21. And so since then, and with all of the testing that we've had over the past few years, we're able to do a lot more without doing an invasive pelvic exam. There are certainly some young women who may want to have a relationship with a gynecologist earlier in life. And I think that that's great and is a great thing to do. But this may be something that you would like to talk to your pediatrician about and see when would be a good time for you to see that specialist.
And let's talk about what is important from a pediatrician's point of view when a kid turns 10. What are you looking for? Is there any preventive care on your mind?
Yes, certainly. I think when I look at adolescents between ages about 10 and 11 up to 21, there are different topics of things that I'm looking at to keep that young person well. And they're really similar topics, but they change throughout the development of the adolescent. So, for instance, starting at age 10 or 11, pediatricians are assessing puberty, seeing how puberty is progressing. We're checking growth, height, weight in relationship to pubertal changes. We're often looking at risk factors for cardiac disease and diabetes for the future. So, things like obesity, trying to establish healthy eating, daily exercise, really healthy habits for youth and young adults moving through life, as well as blood pressure checks, cholesterol screenings, and things of that nature. One of the big things that starts to come at this age are sports clearances, trying to screen and reduce risk of any type of sudden cardiac death, which is rare, but is very scary in the young adult age. And then we start talking about a lot of anticipatory guidance, and that's a lot of the well child check for an adolescent or young adult. And these have, again, similar topics, and the content just kind of changes throughout those years. So, a lot of times as adolescents are getting older, trying to gain independence, they may have different risk taking behaviors. And so, we like to talk about things like safety, helmet safety, seatbelt safety, and things of that nature. Important to open the discussion about substance use and substance abuse because this is something that young adults and adolescents are often coming into contact with in their daily life through their peers and through other ways. We talk about sleep, school performance. We're looking at family life, interactions among the family, interactions among their peers. And starting at this age, we'll start to do depression screening and really paying attention to the mental health of youth. We also talk about sexuality and sexual health, which is a really important topic that needs to be addressed during these ages. Social media has become a really big part of adolescent and young adult life. And so making sure that our young adults have the best ways to interact with social media and technology is very important. Lastly, we're giving immunizations like human papillomavirus, Tdap, which is tetanus, diphtheria, and pertussis, and meningococcal or meningitis vaccines. And then a really big topic that I like to bring up throughout adolescence is starting to educate youth on how to manage their own health care. So, starting when they're younger with little things, maybe engaging in their My Chart, starting to take a little bit of ownership for some of their own health care, and then increasing that as we move through adolescence so that when they turn 18 or they turn 21 and they're all of a sudden an adult, they have all this experience behind them and really know how to manage that healthcare. And that transition doesn't come in just one day.
I like how you say anticipatory guidance because that's looking ahead at what may come or what is to come. But it seems like it also involves the parents. It kind of gives the parents a heads up along with the patient.
Absolutely. And I think a lot of the pediatrician's role is to guide those discussions between the young adult and the parent. So I know we talk about confidentiality and we talk about talking to the youth alone, but know that your pediatrician is really trying to help engage the youth and the parent together and really foster that relationship between them so that they can tackle these challenges that come along throughout life together.
This is Upstate's The Informed Patient Podcast. I'm your host, Amber Smith. I'm talking with Upstate pediatrician Aimee Steiniger about adolescent sexual health. So, what is included in sexual health for adolescents?
I like to include a lot of things in sexual health. Obviously, sexually transmitted infections, birth control or contraception is very important. Healthy relationships are really important. So, allowing adolescents to recognize healthy relationships or what may not be a healthy relationship. And then things like gender identity and sexual orientation are things that youth are really navigating through and trying to figure out very early in life, but especially through this time.
Do girls and boys have questions about contraception, or is that something that you generally bring up?
I think that really depends on the adolescent. I think some of them just don't know that we're kind of an open door to have that discussion. And so when I open the door, I really get a lot of questions, a lot of very great questions that show me that that person has really been thinking about these things, but perhaps doesn't know where to go or who's a good person to talk to about that. And then I have others that I really have to ask a lot of questions to. And that's okay too, as long as the information is getting across. And as long as at the end of the visit, that teen knows that we're a good source of information and we're an open door where we can come and talk about these difficult topics.
Is there a method of contraception that you recommend for young people over other types of contraceptions?
So for me, I think that's very individualized and dependent on the adolescent and what they think is most important to them. What I would say is long acting reversible contraception, like intrauterine devices or implants, are extremely effective at preventing pregnancy if that's our top priority and very safe for adolescents of all ages. And I think this has really been shown in the research and is a really important part of contraceptive care.
You mentioned that you bring up what a healthy relationship is, and that clearly is really important. How do you describe a healthy relationship, or do you have red flags that you share for a potentially unhealthy one?
I think some signs of a healthy relationship are partners that have open communication, especially in the setting of problems or issues that they may have. It's really important for your partner to give you space and time to spend with your friends or family or other people. And your partner would really show support and respect you for who you are. I'd say some red flags can be if your partner's trying to stop you from seeing others, like family or friends, people that are very important to you, someone who might threaten you, someone who could hit, slap, push you. And then things like calling you derogatory names or criticizing you or even humiliating you in front of others or alone. Those are all red flags that we want to look for. There's a really great website called Futures Without Violence that has really great information for parents to open up this discussion and for signs for parents to look for in their youth if they're worried about unhealthy relationships.
What are the sexually transmitted infections of most concern in adolescents?
I'd say over the past couple of years, we've definitely been concerned with an increase in sexually transmitted infections among this age range, probably for a lot of reasons. A lot of these infections do not have any symptoms, and people may not be aware of that or aware that they're having the infection. And so it's really important to be screening sexually active young people to make sure that we're really helping them stay healthy. I see chlamydia is the most reported sexually transmitted infection in New York State, and 47% of those diagnoses are among people younger than 26 years of age. So that's a really important infection that we want to make sure we're screening for and checking for. Gonorrhea is also really important that we're checking. In New York State, among males in 2022, the highest gonorrhea rates were among those aged 20 to 24. And among females, the rates were highest among those aged 15 to 24. Meaning it is a really important infection that we need to make sure we're paying attention to in our young adults. Syphilis cases nationwide are increasing, and it's really important that we're thinking about screening for syphilis because I think it's not always something that we're thinking about. HIV as well is so important that we're educating youth about. We now have something called pre-exposure prophylaxis, which is taking a medication every day to prevent HIV. It reduces your risk of getting HIV from sexual intercourse by 99%, which is phenomenal and is very safe medication to be using. When I think about STDs, I'm always thinking about the treatments and things of that nature. So chlamydia and gonorrhea, we have treatments and cures for, as well as syphilis. Syphilis's treatment is penicillin. So it's a pretty easy treatment for an STD that we really need to make sure we're watching out for. HIV still has no cure, but I think PrEP is really an important thing that young people and all people know about so that if they are engaging in higher risk behaviors where they may have an increased risk of HIV acquisition, that they can ask their doctor about it and consider whether it's right for them.
Any advice for parents about how and when to talk to their kids about sex?
Absolutely. So I think what's really important about this is talking to your kids or teenagers about sex shouldn't just be one big talk and then it be over. It's really something that should be a process that over time, teens and young adults can learn about, and that there's an open door of communication between parents and their young people. That kind of relationship can really help teens know that they can come to parents when they're wondering about how their body might be changing when they're younger, or maybe about sex when they're older. I think whenever your teen comes to you with a question about sex, it's important to answer it in a developmentally appropriate way. One of the ways that can open a door is when teens come across this information, either in social media or on the television or through music. It's really important that you can use those opportunities as a way to open the door and talk about sex and healthy relationships. It's a good chance to talk to them about what they saw on the TV or heard in the song and ask them what they think about it. You'd be surprised how much they can tell you about what they think and what they know. It's really important to listen more than you talk, and that can really give you a lot of insight into what your teen or youth is thinking. Another piece that I think is great is to not always have the word don't. So don't do this. Don't get pregnant. Don't get a sexually transmitted infection. It's good to educate them about the ways to protect themselves against those, but you could make sure in your discussion you have more do's. Like, what can they do to be sexually healthy with a partner that they do care about? How can they address pressure to have sex when they don't feel like they're ready? And then who can they come to talk to about sex when they're ready to have that discussion? These are really important. And I think what also can be really important for parents is acknowledging sexuality is not necessarily the same as condoning or giving your youth permission to have sex. So it's important to share your values and your thoughts about these things in a non-condescending way, and then give your youth an opportunity to share with you what they think and what they feel. So I think having this long conversation over all the adolescent years and really being a place that your teens can come forward and feel comfortable talking to you about these things is really the best way to talk to them about sex.
Dr. Steiniger, thank you so much for making time for this interview.
Of course, you're very welcome. Thanks for having me.
My guest has been Dr. Aimee Steiniger, an assistant professor of pediatrics at Upstate. The Informed Patient is a podcast covering health, science, and medicine, brought to you by Upstate Medical University in Syracuse, New York, and produced by Jim Howe. Find our archive of previous episodes at upstate.edu/inform. If you enjoyed this episode, please tell a friend to listen too. And you can rate and review the Informed Patient podcast on Spotify, Apple Podcasts, YouTube, or wherever you tune in. This is your host, Amber Smith, thanking you for listening.